going to talk about digital componentry, digital options for the dental office. I'm Alan Banks. This is Dr. Isaac Tawil. The Shining 3D, maybe you do, maybe you don't know of them. They are a world leader in digital technology, originally not dental, but now in dental. Lab scanners primarily. That was their real claim to fame. But they took their knowledge and they brought it into the dental office. And we now have packages that we think doctors are going to be very interested in, and we'll talk through those. But the packages are going to fit into where you are. As one of our philosophies here is we meet doctors where they are digitally, which means we use this level, this series of levels. So if you're a level 2, you have an iOS scanner. You're just acquiring digitally. If you're level 3, you have a scanner, and you also have the ability to print. If you're level 4, you also have a lab scanner. And if you're level 5, you're milling zirconia. You pretty much have an in-house laboratory. So our idea is to meet you where you are technologically, and that's why we really embrace this whole Shining 3D philosophy package deals that they have, where you can purchase equipment either to bring in and merge with your existing technology, or you can kind of start over.
Correct. And
purchase this whole Shining packages. And I guess the first question is, why would I just purchase a whole new package of Shining equipment?
That's a good question. So why would I want to get a brand new scanner or go into this new evolution of digital dentistry that Shining 3D has put together? Well, we could start simply with discussing about the entire ecosystem. You have a scanner which should be wired or wireless, which works just as well as any scanner on the market, if not better. The technology is just absolutely incredible. We can delve in deeper into that. But the ecosystem itself of using the intraoral scanner, being able to have that combined with the printer, with the wash, with the cure, having the desktop scanner, and also having the facial scanner, gives us the ability to take the entire patient and take them from the analog world and move them over into the digital realm. And laboratories or lab techs know digital. They understand how to do things in the digital realm. The analog realm has been kind of diminishing over the years, and new programs like 3Shape, ExoCAD, Dental Wings have taken over into the completely redesigned atmosphere of dentistry, which is digital revolution. So marrying the two together, creating what I like to term as the digital handshake, marrying the analog to the digital could be a little bit daunting when the prices are so high. So if we look at affordability, we look at accuracy, we look at the ability to have an entire ecosystem at just under the price of buying a 3Shape scanner, all in one house, and everything talking to each other. Our communication either in-house or if we use an outside laboratory has now been simplified dramatically in a very affordable solution.
It's very impressive. If, for instance, our laboratory is involved with a lot of full arch restorations where the doctor is scanning, we're designing, they're printing. And until recently, that would have meant that a doctor would have an iOS from this company, a printer from this company, maybe a different curing unit. Maybe they have a lab scanner, probably not, and definitely don't have a face scanner. So they have, it works, but it's kind of a hodgepodge of different companies, and then you have to get all those to work together somehow, right? I mean, sure, it all works with an STL file, but you still have to kind of just go down a trail of using different companies.
Yeah, it's like anything else in electronics. If you want your speakers to talk to your audio system or to your television, you have to marry these products together.
Right. Are you talking speaker wire or HDMI?
Exactly.
You're talking old
AV wires,
yeah,
and
right,
it's
right.
all different componentry. When everything can talk to each other in its own ecosystem without you having to do any work, it just makes life that much easier and enables the laboratory to just communicate at a much higher and more efficient level.
Right, right. So you purchase one package, and then is it go time? There's some training and there's some learning that goes with it, like with anything, and training comes with this and a support package. But you're going to be a lot quicker into the capture and printing, curing, cleaning if you buy a package from one company. And then you can also, which I think is one of the best things, especially if you're involved in big cases, You can have a face scanner, which is very affordable. It's
Yeah,
the
and a
least
game
expensive
changer.
one on the market.
And the game changer.
It arguably the best one and the least expensive. We're doing better work if you have a face scanner. It also automatically talks to the iOS scanner. So you scan the mouth, scan the face, puts them together, hit a button, and off it goes to the laboratory, which is just brilliant. And then based on that, we get our records, and then we send them back for you to print in that same ecosystem, printer, curing unit.
Much easier for the lab to design. If they know where the teeth are in relationship to where the lips and the eyes and the nose are, then they can design you a better teeth for your temporaries, for provisionals, and also able to utilize that for your finals.
Yeah.
As we did today, earlier today, we had a facial scan, a pre-op facial scan, and we took a post-op facial scan on the patient. But we based it all off of the pre-op facial scan, made all the corrections we needed, and then delivered it a prosthetic. And we just, for fun, took another facial scan to do the comparison, and it was dead on.
Yeah, I mean, and you know, all the full arch cases that you do, I mean, how often do you have to move a midline considerably, even change an entire plane of occlusion? And how do you do that if you don't have the patient? And you can do it with a 2D photo, but it is not the same.
No.
As soon in the software, as soon as you go left, right, up, or down, you're completely in different planes.
Yep.
They completely separate. But with this particular face scanner, it collects the data between the lips and the teeth very well, and so you can oscillate around the patient and you can really see the detail of the teeth in relation to the face. And that is not a luxury item anymore.
No, that's the most important aspect of facial scanning. 'Cause facial scanning for years has just been a novelty. It's just been something to say as eye candy, like, look at me, I can take a facial scan. And if you didn't have fiducial markers, you weren't able to do this point matching. The auto merge feature is fantastic.
Yeah.
Using the intraoral scan to actually take your intraoral scans, it's an easy 1, 2, 3. But even if you're not, you can import your scans and it can still try to do the auto merge. But let's say you can't auto merge. Having the ability to see all the aspects of the teeth from the facial scan,
Right.
to be able to do point matching between the OBJ, PLY, STL file, and the actual facial scan.
often the tricky part.
That's the hardest
Yeah.
part. That's the hardest part. Whatever software you're utilizing, it's the hardest part. With all the AI technology we have in this, and we're not meeting that demand yet. Now we can do that with ease. So if you have to do manual point matching, not a problem. If you're using the auto merge feature, which works about 99% of the time,
Yeah.
especially when you're using the entire ecosystem, using the intraoral scan plus the MediSmile, it'll just match with ease. And you're basically done. You're shipping it off to the lab with your changes that you want, moving the midline over. And this is not just for full arches. This can also just be for, let's say, some
Make a
central
denture.
incisors. No,
Make a
let's say you're
denture,
doing two central
yeah,
incisors,
doing some
and you
veneers.
want to get your midline corrected, or you're doing some veneer cases,
Yeah.
an 8 veneer case, or you're doing dentures. All of
think-
this helps you to give the lab better communication and makes it more efficient, so you don't have to have several visits of try-in. We can do things sometimes in just a matter of an impression and then an insert,
Right.
which is what we've been doing for our full arch cases now for the last 6-7 months or so.
Yeah.
Straight to final.
Pre-
In this
pre-
case today, we did a double arch straight to final with major corrections.
Major.
Major corrections.
An occlusal plane that dropped 4 millimeters with 100% digital workflow with face scans. I mean, that's the kind of thing you would want to show your patient with their face there. You can't
Correct.
just add wax on articulator and say, what do you
No.
think? But it doesn't work like that.
Doesn't work like that. Doesn't work. You really need that facial scanner and be able to utilize the transparency features on that to show the patient exactly what they look like now and what they can look like once they're done. And if you can be able to deliver, it's one thing to be able to say that you have certain expectations about a case. It's another thing to be able to deliver it.
Right.
And having all this technology, having the complete bundle, gives the ability to actually deliver what you promise. Often, what we have a saying, we want to under promise and over deliver. This is now, we're coming to the age where we can promise and deliver. We don't have to under promise anymore. We can give the patient what we set out to do from the beginning of our cases.
And communicate it to the laboratory.
Exactly.
Right.
That's the key feature.
Yeah. Promise chair side, the laboratory still has to
Deliver.
Has to deliver,
Yep.
yeah. So the packages are available on our website. You can pick and choose, and like Dr. T said, one of the packages, which would be just about complete, is the cost of one of the other iOS scanners. Yeah, I don't know how they made it that affordable, but it's really incredible. And that would include a face scanner, iOS scanner, print, clean, cure unit. And then if you want to add a lab scanner, of course, it's going to be a little bit more. But it's really nice packages, and it helps It helps us offer the ability for a doctor to move from level 2, level 3, level 4, and even into level 5. We can help doctors make that transition, and this package is really part of that. So thanks for all the details on that.
No, my pleasure.
Clinical director. And as always, follow us on all the platforms, Facebook, Instagram. We're on there. We have a lot of content that we share. We're kind of an open book. And to learn all the details about the packages or even the individual items in the package, like a face scanner, just go to rowdentallab.com and just put /shining, which has information about every single component that we're talking about in these packages, links to buy, and then links for all the specs of them that you'll need to get started.